Oh my god, enough with the fat around the organs. That is not a real thing. It is made up. Maybe you should keep the comments to yourself until you actually know what you're talking about.
Hello YouTube, and welcome to the Body Honesty Project. My name is Lydia, and today I have for you the second part of my conversation with Chris in real life, where we talk about fat activists that are either medical professionals or have some sort of credential and use that to strengthen their position, even though they're delivering misinformation. But before we get into the conversation, I think we need to see what sort of messaging Fat Dr. UK says. So why don't we watch this next clip, then come back and discuss.
Someone just asked me if there's such a thing as eating wrong. Now, logically, if there's such a thing as eating wrong, then there must be such a thing as eating right. And that's a lie that we've been fed since infancy. There's no such thing as a right way to eat. Just like there's no right way to live. We're all different, we're all unique. We live life the way we need to live life. So when it comes to the right way to eat, just eat whatever you want. Whatever makes you happy, whatever you need to eat to get through the day. You want to eat all organic, like natural, raw food, then go for it. You want to, live on convenience food because that's literally all you can do, then go for it. Eat what you can afford. Eat what you have time to cook. All of it's good. Literally all of it. You only get one life, so live it however you want to live it. The end.
So earlier we were talking about jock scientists and people like that speak from a place of authority, or like Fat Dr. UK. Do you think that these people should be held accountable? Because they go on TikTok and they say all these things like, Fat Dr. UK, I think, is the worst. Fat around the organs, it doesn't exist.
Oh God, we could do a whole panel, just all of us discussing her. Oh my God.
So all the misinformation, people follow, they see doctor, then they get sick.
Mm-hmm.
Should there be some accountability?
I think if you hold some type of professional license or certificate or position, yeah, you absolutely should be accountable, because just Joe Schmo from off the street saying something, like Tess Holiday saying something about fat is healthy, fat is okay, versus the fat doctor saying it, people are going to put more stock into what a doctor or a therapist or somebody trained in physical fitness says, because, well, they went to school, they have the education, they know how it works, and it's harming people. That, like I said, that's really why I started it. And I think the Fat Dr. UK was one of the ones that really made me say, okay, I'm going to start recording, I'm going to start making videos, because this is dangerous. Saying that fat doesn't actually develop around your organs and cause problems, and that sugar and excess food and excess weight doesn't cause diabetes, and losing weight doesn't. And I am like, this is actually dangerous. It is actually dangerous, and it's going to hurt people, and it is hurting people. So yeah, there should be some accountability. I think like all of these anti-diet dietitians, like, come on, anti-diet dietitian, doctors, therapists, stuff like, if they go on sites and they want to say this stuff, fine, but they should say it with the risk of getting their professional licensure revoked, because it is dangerous. And people put you go to, if you go to a car mechanic, you expect him to know what's wrong with the car and to fix it, versus just some person off the street who doesn't work on cars. So when people have a profession, people trust you, and they're absolutely taking advantage of that trust, because they know that people want to hear what they want to hear, and they want to be reassured, and they're so caught up in their own bias. And like the fat doctor, she didn't lose weight, she wanted to, she didn't. I can kind of see how she fell into it.
Doc scientists too.
Yeah, and the thin ones who are thin and stay thin and don't gain weight and push all this, it's not unhealthy, it's not dangerous. Okay, well then get fat, gain 50 pounds, and tell me how much you like yourself and how good you feel and how your health is still the same. And they won't do it. And they won't admit, they can't admit too that, well, I like how I look better when I'm thin because I look better skinny than I do really fat. And I'll tell you from a medical standpoint, their crowning argument about my blood work is great. Well, it is until it isn't.
Right.
And on any given day, it can be good by chance. You can manipulate your blood sugar, your cholesterol, your sodium, all within a couple days just by altering your diet. So
Hmm.
while that's one thing, it's really not that good of a metric. And it's like, are they looking at your liver enzymes? You're not looking at the fat around your liver. They're not doing fasting insulins to see the elevated insulin. Are they running an A1C? Are they going and doing a calcium check on your coronary arteries to see the buildup? Are they doing inflammation markers? So no, they don't come out with that, because that stuff, the more advanced blood work would show a different story, I believe.
Yeah. Yeah, they want to believe so badly
Hmm.
that the fat is not affecting them. But I find it just okay. We are human beings that exist with fuel. Our fuel is food. The fuel helps our hair grow, our nails get strong, give us energy, help our bones grow. If we know that the fuel does all this stuff to build our bodies, help us reproduce, how can we say that the quality of what we put in does not matter?
Exactly, it does. It absolutely does.
It has to
It,
matter.
it, it just does. And it's funny because they try to push this, oh, fat is just soft and squishy and it keeps us. The funniest thing is how, oh, the belly bulge, that's your uterus. You need
Hmm.
no, you don't. Your uterus is maybe about this big,
Hmm.
and unless it has a baby in it, and your stomach can be completely flat and you've got room in there. Okay, you were made quite efficiently, there's room for everything in there. But they say fat is just, it's protective and it keeps you warm, and it does keep you warm and stuff, but they act like it's some benign thing. And we have learned more and more about fat in recent years, and like the visceral fat is the most dangerous, but a lot of doctors and people are actually considering fat as another organ in it and of
It's
itself.
active. It's active.
It's not, yeah, it's not this innocuous thing that
Hmm.
just sits on your body and misshapes it or whatever. It releases a lot of hormones. It
Causes
messes with
headaches.
your, yeah, it's very estrogenetic. It's why, that's why men that start getting fat, they start having problems with estrogen and they get like the man boobs and all that. And it's like, it's not this benign substance. It really does have effects. So, I mean, and they're willfully deaf, is what I will
Hmm.
say. They're
Another
willfully deaf about it.
another thing that I always notice about the fat acceptance people, that if they change their diet, they could spend a whole lot less money on. And I think that myself and Kayla Shea are good examples of it. Um, your hair and skin is better when you eat better.
Yes.
I spend all on my hair. I swear to God, and it's like the number one comment always,
Hmm.
what do you do
Yeah,
for
it
your
looks
hair?
great.
What do you do for your hair?
Mhm.
Nothing. I eat well. That's
Yeah,
seriously
and
like same thing. I'm
well,
not like I'm
yeah,
wearing eyeliner. I'm not wearing any. Yeah, I'm 45. I have
yeah.
nothing on my face
Mhm.
other than the eyeliner and lipstick.
Yeah, and what they don't understand is it's kind of, you got to look at it this way. Like if you have inflammation and stuff going on in your body, um, like the last real place that's going to show is if it's starting to show on your skin and you're getting rashes and hives and problems like that, that's usually indicative of something internally going on. So that's why when people really clean up their diets and start exercising and start losing weight and stuff like that, that's why they're, oh, my skin looks so much better and everything, because your cells, depending on the cell, regenerate every, what, 30 to 90 days. So if you've been on a diet for a few months, your cells have regenerated healthier and better. So it's clearing up, and a sign of your skin clearing up and everything is just a sign that things are kind of going better internally. Like there are signs that you can look at, little things that will show you a problem with a bigger picture. And like the skin is one of them. Another one, and this is fun for any guys who watch, that actually erectile dysfunction.
Mm-hmm.
It's not just, oh, he's getting old, he's having some problems. It's actually a sign that especially if you're an older male, that you might want to go and get checked for coronary, for atherosclerosis, for heart disease, because the vessels there are a lot tinier and thinner than in the other parts of your body. So they will start having problems first. So usually ED is the canary in the coal mine, if you will, that you actually have some type of advanced state of heart disease going on. So, it there's a lot of little things that tell you there's a bigger picture, and that's one of them. The skin is definitely one of them. Your
Mm-hmm.
sleep is one of them,
Yeah.
your joints, anxiety, all of that stuff can tell you that there's more going on. And they all say, oh, well, you cleaned up your diet and you lost weight. It's not the weight you lost that did anything. It's because you were moving more, right? You were doing more joyful movement, or you were eating more, and you're not allowed to call any food good or bad. So it's like they'll spin it any way they can to insist that it wasn't the food and it wasn't the weight loss that improves anything. It's just pure happenstance.
Yeah, I know. Right. I get a little bit of joy proving their arguments wrong. I did a video about Hannah, and she was talking about heart disease, and she was talking about the correlation between male pattern baldness and heart disease, and then obesity and heart disease, and saying, well, that just correlated. Are we supposed to say that just because you're losing your hair, you're gonna get heart disease? That's silly. That was Hannah's argument. I did the research and found out that obesity does cause male pattern baldness. So really what's happening is the obesity is causing men to lose their hair and cause the heart attack. So Hannah, your argument is bunk. Like,
Yeah, it is. It's a genetic thing to a point, but yeah, again, that's because it goes back to having a lot of excess weight and a bad diet can, I don't know if it's hormonal or whatever, but you would assume something like that would affect the hair. But see, they will dig, but they will only dig enough to find what they want, or they'll cherry pick a lot of study. Like some of them are the worst for
oh
cherry
yeah.
picking studies and twisting words. Your buddy Pat Sapphic bro does that all the time.
Oh, I know. Did you see the battle? Did you see the battle video?
Yeah.
Oh my God, that was I had a whole bunch of I had a bunch of my subs texting me on Instagram while it was live happening. And I had some of them like giving the meme of Michael Jackson with the popcorn going like we're watching it
Yes.
go. And it went deep. It went way deeper than that. And then they deleted the thread before I got a chance to capture it. But
Yeah, and they're people like that. A lot of these FAs are really good at dishing it, but they can't take it, and they will say what they want to say and have their word. But if you say anything against them or call them out, they don't like it, and they will like
oh yeah.
have an actual call to action, which is not allowed again on TOS, first of all, but their little minions will come and try to cancel you,
Mhm.
and their work is done, or they will ignore you. But the thing is they bully people, and they don't like when people clap back and go, really? Well, I'm gonna prove why you're wrong, and I
Mhm.
can say what I want. That's why people like you, someone like, go ahead, come for me. I don't care.
Yep.
Someone like Alan, they don't like it. That's why they'll never take us up on a, hey, come online, come live, and
Yep.
let's see this, and let's call it out. They'll never do it. And I've had a couple people, not many. I've been pretty good so far, but I've had a couple people in my comments get on me about, oh, fatness is there is genetic, and there are medicines and stuff. I said, yeah, medicines maybe make you gain 5, maybe 10 pounds, and part of it does have to do with it messing with hormones and lowering your metabolic rate and stuff. But it all comes down to, okay, these medicines affect these things, so I need to eat less or I need to move more. It still comes down to, you have to adjust your lifestyle, and anything to not be accountable. And it's just so funny when you see them, they get so mad, and they just get so triggered. And I remember seeing that with Pat Sack, bro. And Alan's got a few of them of himself, of his own,
Oh yeah. think Jordan.
Jordan
Yeah. Jordan and
and
Tata.
that Samara,
Yeah.
Samira.
Yeah.
It's like I'm doing some spotlight videos now. I finally just started, but I was like, I know when I start singling people out, it's only a matter of time before
Yeah,
they'll
they'll
come
find
for me.
you. But the thing is,
I
they don't.
consider it a badge of honor. Like,
Oh yeah.
yeah,
That's what my subby said as soon as I got attacked by FSB. They're like, "Oh, wear it like a badge of honor. You finally made it." Like I
yeah,
got
like
attacked by
yes,
FSB.
you're on their radar. You made them mad. It's like, all right, yeah, and
But
it's like
all their attacks though, they stoop to name calling and like you're a troll, blah blah blah, you're a hater. If
and
you
making fun of your side, your body, your
I never
looks.
every last thing that I said, I was only criticizing their content. I explained, I'm like, they said stop making content about me. I'm like, thanks for the suggestion, but I won't be doing that.
And and the thing is like I try not to make fun of people's look. I'll say, oh, like fine, let her wear what she wants. She wants to wear that. That's her style. Okay, that's cool. Whatever. I'll say, oh, this person, look, she has a cute face. She looks cute. But like, I don't tiptoe around the whole thing about, oh, okay, well, she's too big, and that's unattractive, and you can't see her features anymore and stuff. And it's like I'm like, and I'll always preface, I say, I wish I had $1 every time I said, I'm not trying to be mean, but but then it's like, and one of the biggest times where I have to like preface that is when I'm reacting to like Amber Lynn,
Mm-hmm.
because she's got such severe, and Jordan, they've got such severe lipedema and lymphedema from their excess weight. It's like, okay, I can't beat around the bush. I have to point out, look, this is a physical thing with them that's going on. This is a physical problem, and it's because of their weight. It's directly related to their weight, and it's hindering them. It's making them immobile. Like, quit saying how Amberlyn can't drive and she should take Ubers. She can't drive. She can't take an Uber. She cannot physically fit. And it's like, so I have gotten some flack about that. Like, oh, you can't talk about people's size. But you get to a certain point where your size does come into play. Just like Eugenia. It's
Mm-hmm.
okay to talk about her size and how it's unhealthy and dangerous and oh my gosh, it's
Yeah.
scary. Okay, why is it okay to do that to her, but we can't say that about
Yeah.
Tess and
And
how she's
the fat activists will actually quote Eugenia's BMI as well. I'm like, I thought BMI was a bad thing. But
oh
they'll
no
say,
no, it's for
oh,
thee, not
Eugenia's
for me.
BMI is like 16. I'm like, but if BMI doesn't matter, why do you care?
It doesn't matter when it's bad for them. And then it's so funny because like I agree with Alan where they're like, okay, fine, if BMI isn't good, use height to waist ratio. Because
Mm-hmm.
then that would really piss them off
Oh
because
yeah.
that would be even worse for them.
Oh yeah.
It's like they just don't want you to use anything. And I'm telling you, from somebody who's worked in a hospital and a doctor's office, it is medically necessary every time you go to the doctor for them to weigh you.
Mm-hmm.
An excessive weight suddenly can be indicative of like kidney problems or a tumor growing or something, you know what I mean? It's like it's usually not, but it is important. It just cracks me up because they're like, I refuse to be weighed, and I turn around, I can't see the number on the scale, and don't write it on my chart, don't tell me. And I my biggest thing is like, okay, you're proving yourself a hypocrite right there.
Yes.
If you are so confident and your size is no problem and you're proud of it and you love it, you would be tweeting that number out to everybody.
Yeah.
Hey, I was 308 at the doctor's today. I gained 10 pounds since the last time. The fact that they are so sensitive
Mm-hmm.
about being weighed and those numbers and the needing vanity sizing and stuff, that shows you that they are inherently insecure about their
Well,
weight and they do make it.
Jordan even proved how essential getting weighed at the doctor was for them
Yes.
because they made a video about how they gained 40 pounds in a month because it was like swelling due to the lymphedema. So
Yeah. Oh my God.
tell
Yeah.
avoiding getting weighed, you needed to get weighed. That was a huge
Exactly.
red flag to get treatment. If you avoid getting,
Yeah, did. And I'm telling you, like, see, and people always say, well, I want to know what Amberlynn's legs look like. She'll never show them. Look at Jordan's.
Mhm.
That's a very good indicator of what her legs, what her feet probably look like. And I legitimately am concerned from a medical standpoint about people like Jordan and Amber and their legs and stuff like that, because there is definite circulatory issues going on there. And then with the bad diet and possibly developing diabetes and having like skin that breaks and getting rashes and stuff like that and infections. Like Amber is like casual. She gets cellulitis like 4 times a year in
Hmm.
her legs. That's not normal and it's not healthy. And it's really dangerous. So as far as your circulation and your ability to return blood back up to your body and fight infections and your lymphatic system working, you need to know these things. And yeah, Jordan at her size wouldn't have known he'd actually gained that weight if it hadn't been weighed. Would have just maybe felt, I don't know how, but I'm sure felt worse overall. And perfect example, she did treat and then look, not doing what she needs to do. Oh, right, rather unalive than go on a keto diet and stuff. I mean, they act like, see, this is why it's like, okay, so you're not addicted to food, you don't have a food problem, like
Yet you're gonna cry your eyes out because you don't want to do keto.
because you get to eat meat and cheese and dairy and vegetable. It's like it's not the most restrictive diet in the world, but they're mad because they can't have sugar and
Yeah.
pasta and cake and
Well,
candy and
Hannah has this one video where she talks about when she's on a diet, all the alarm bells go off in her head. And she
mm,
says, because there's a famine. I'm like, honey, that's addiction. Those bells,
yes.
that is addiction. And this is where I will come down really hard on the mental health part because I'm someone who's been dealing with a whole lot of problems. I'm not going to get into all of them in these videos, but I understand chemical issues in your brain. I understand the need to get it treated. I understand that some of us, like myself, have depleted serotonin. We have very, very poor impulse control. We have to medicate. We have to do a whole lot of exercises to get it under control. I'm going to slip up with some problematic impulsive behaviors from time to time, but I'm working on it. This is the piece that I dislike about fat acceptance. I believe these people when they say that they have trauma and they have issues. I have trauma, I have
Yeah.
issues. I understand that. But I'm seeing a therapist, I'm seeing a doctor, I'm trying to get it under control. Having these issues does make it more difficult. But just saying, I have the issue, therefore I'm allowed to eat is like being an alcoholic and saying, I have this issue, therefore I'm allowed to drink.
Uh-huh.
And say, I have this issue, it makes me drink sometimes. I'm trying not to. I might F up sometimes. And I'm the same with food. It might binge sometimes. That's fine. You're human. You mess up. You do have a problem. But it's not a reason to just give up. And this is like, that's what I
Yeah,
hate. I have
it's a
mental health
victim
issues.
mentality.
Other people have mental health issues. Work on them. They can be a
Yes.
reason, they can be a legitimate reason why it's more difficult for you. I will buy into that.
Mhm.
I'm not going to be as harsh as some of the other critics that say, just smarten up, just put the fork down. No, if you need help, if you need medication, you need a doctor, you need that, get that. But
Yes.
saying I have trauma, therefore I can't lose weight is BS. Saying you have
Yeah.
trauma and say, therefore I have to work on my trauma, therefore I need help with my trauma, and that will help me. That is what I want to hear. I
Yeah,
won't
exactly.
dismiss it. Yeah.
Things that have happened in your past. Yeah, it's like those are legit and everything. But like we've all had effed up things happen to us. You know what I mean? It is what it is. But it to use it as an excuse where, oh, I'm a mean person and I over like you said, it's not an excuse to say, oh well, this happened 20 years ago or whatever. It's an excuse for me not to work on myself now. At some point, you're an adult. You have to take responsibility and say, I don't want to be like this. I don't want this to hold me back and I want to better myself. But it takes doing the work. It takes wanting to, and they don't want to, or they go see an anti-diet haze therapist, which is like you might as well talk to the wall.
Exactly. Before we wrap up, can you give my viewers some final words on how Chris achieves balance in her life and in her nutrition?
Chris still works on it from day to day. I know what I did. I have done the work over the years. I've gone to therapy. I've learned um how to kind of manage these things. And while binging and stuff like that is still a very much a physiological thing, you get those physical urges. I try to just kind of give myself some grace when I screw up and understand if I'm having a bad time. But for the most part, I know I can't have certain things in the house, and I know I'm not going to be able to eat and be 100% like other people, and that's okay. I have these issues that other people don't have. That doesn't make me a bad person. That's nobody's fault, but I can be as much of a normal person as anybody else. I just have to take different steps to go about it. So I keep track of stress, of things that trigger me, and I just try to eat a balanced diet. I try to eat a balanced diet as far as you try to eat mostly whole foods. Don't give in to your cravings all the time, but allow yourself to have those treats every now and then. Once you get to a point where it won't send you off the rails, um, and allow yourself to have that flexibility and just learn what works for you. But above all else, um, minimize the processed food. Try to stop snacking if you have excess weight, and do something that you enjoy, that helps you relieve stress, so that you're going to that as opposed to going to food, and get some movement. My favorite thing is just walking outside. Or I spent no more than 120 bucks on Amazon and got a cheap X spin bike from Amazon, and it's quiet. It fits right in the corner of my living room. I'll get on that and listen to a podcast or listen to something, and just kind of use that as a stress reliever. If I want to have a treat, or if I want to cheat, I'll go, okay, go walk for 20 minutes or go spin for like 15 minutes. And then if you still want it, maybe have a little one. And most of the time those cravings pass, and you can overcome those type of things. Um, you just got to learn to kind of deal with them a little bit and get past them, but it does get better. But trying to eat whole foods and minimizing your processed foods is absolutely vital. You can't have balance living on McDonald's and processed chicken nuggets and all that stuff. And if you need help, don't be embarrassed to ask for help. Don't be ashamed to ask for help. There's no shame in that. And just take it one day at a time. If you screw up today, there's always tomorrow. If you screw up this past meal, pick it up on the next meal. You got to be able to have some grace, but understand that those certain habits aren't healthy, and you shouldn't just give in to them, but you can fix them. You can adjust them.
That's some great advice. Thank you so much for offering that, and also thank you so much for being on the channel today.
Thank you so much.
Hopefully you come back and maybe play Foursquares with us.
I would love to. I think that would be so much fun.
Yeah, I have to be able to think fast. We put each other on the spot. I was thinking that the next time I play Foursquares, I would do something like, okay, Cynical, what do you hate about my content?
I love to see put them on the spot. Like, what?
Or do something like, okay, Alan, what does Starzan say that's wrong?
Yeah. Yeah. Alan, what's your favorite thing about your buddy Samara?
Yeah.
What?
Doing something like that. Alrighty, well, I got going, but again, thank you, and I will be in touch soon.
Yeah, thank you so much, Leah.
Okay, take care. Have a good day.
Take care.
Bye.
Bye.
I'd like to thank Chris again for coming on the channel, and if you didn't see the first part of our conversation, you can find that video here. And of course, don't forget to go and check out Chris's channel that you can find over here. So until next time, stay body positive, but also body honest.